Optimizing health for extremely busy people. Part 3. Fundamental technique. Abdominal breathing. Diaphragmatic breathing. Scientific reason. This is the most natural and effective breathing method, serving as the foundation for all advanced breathing techniques. Abdominal breathing optimizes gas exchange, directly stimulates the vagus nerve, thereby activating the parasympathetic nervous system, helping to slow the heart rate, lower blood pressure, and reduce the stress hormone cortisol levels. How to perform. 1. Find a comfortable position, either sitting upright on a chair or lying on your back. 2. Place one hand on your chest and the other on your abdomen, just below the ribs. 3. Inhale slowly and deeply through your nose. Feel your abdomen expand and push your hand outward. Try to keep the hand on your chest moving as little as possible. 4. Exhale slowly through your mouth, lips slightly pursed as if whistling, letting your abdomen gradually deflate. Feel yourself pushing all the air out of your lungs. 5. Repeat 5 to 10 times, focusing entirely on the sensation of your abdomen rising and falling. Quick relaxation technique. Box breathing. Scientific reason. This technique is famous for its simplicity and immediate effectiveness. The steady 4-4-4-4 rhythm helps the mind easily focus, breaking the cycle of anxious thoughts. Controlled breath holding helps balance oxygen and CO2 levels, soothes the nervous system, and enhances alertness. This technique is used by special forces, such as the U.S. Navy SEALs, to stay calm in high-stress situations. How to do it. 1. Exhale all the air from your lungs. 2. Slowly inhale through your nose, counting to 4. 3. Hold your breath, keeping air in your lungs, counting to 4. 4. Slowly exhale through your mouth or nose, counting to 4. 5. Keep your lungs empty, hold your breath, counting to 4. 6. That is 1 cycle. Repeat 5 to 10 cycles, or for about 2 to 3 minutes. Sleep support and anxiety reduction technique. 4 to 7-8, breathing. Scientific reason. Developed by Dr. Andrew Weil, this technique has a natural calming effect. The exhalation time, 8 seconds, is twice as long as the inhalation time, 4 seconds, strongly activating the parasympathetic nervous system. The breath-holding phase, 7 seconds, allows oxygen to fully saturate the blood. This technique is especially effective in combating anxiety and helping the mind prepare for sleep. Clinical studies have also recorded its effectiveness in reducing anxiety levels in patients. How to perform. 1. Sit up straight or lie down comfortably. Place the tip of your tongue against the roof of your mouth, just behind your upper front teeth, and keep it there throughout the exercise. 2. Exhale completely through your mouth, making a whoosh sound. 3. Close your mouth and inhale quietly through your nose, counting silently to 4. 4. Hold your breath, counting silently to 7. 5. Exhale completely through your mouth, making a whoosh sound, counting silently to 8. 6. That is 1 cycle. Repeat 3 more times for a total of 4 cycles. Table 2. Comparison of breathing techniques for busy people. This table helps readers quickly choose the most suitable technique for their immediate needs. Technique: abdominal breathing. Main purpose: foundation, strengthen the diaphragm, reduce chronic stress. Difficulty: beginners. Easy, immediate effectiveness and notes. When practicing, feeling calm, deeper breathing. May feel tired at first, persistence is needed. Source: technique, box, 4 to 4, 4 to 4. Main purpose: acute stress, increased focus, easy to remember. Difficulty: easy notes when practicing. Calm mind, quickly reduce heart rate. Do not hold your breath too hard, keep a steady rhythm. Technique: 4 to 7. Main purpose: reduce anxiety, support sleep. Difficulty level: medium. Notes when practicing: causes drowsiness, deep relaxation, may cause slight dizziness at first, should not be practiced before needing to be alert. Building sustainable and safe habits. Psychology of habits, from intention to action. Knowing what is good for your health is one thing, but turning it into consistent action is a completely different challenge, especially for those with busy schedules. Building habits not only relies on willpower, but also requires smart psychological strategies to overcome barriers and naturally integrate new behaviors into life. Breaking psychological barriers. Before building new habits, it is necessary to identify and dismantle common psychological barriers. I don't have time. This is the biggest barrier. The solution is to apply the concept of micro-workouts. Studies show that multiple short sessions, 5 to 10 minutes, spread throughout the day provide benefits equivalent to one long session. Instead of thinking you need to set aside 30 minutes, aim for just 5 minutes. I'm too tired. There is a biological paradox that light physical activity actually helps generate energy. Physical activity enhances circulation, supplies more oxygen to the brain and muscles, and releases endorphins, the happiness hormone that improves mood and reduces feelings of fatigue. Exercise is boring. To combat boredom, diversify your workouts and find activities you truly enjoy. Exercising with colleagues or friends can also increase fun and commitment. All or nothing thinking. This is a dangerous cognitive distortion. Many people set a goal to exercise 5 days a week, and when they miss a day, they feel like a failure and give up entirely. The key to overcoming this is to focus on consistency rather than perfection. Remember, a 5-minute workout is better than none at all. Applying self-compassion when missing a session and returning the next day is essential. Habit formation strategy. Based on behavioral psychology research, there are 3 main strategies to integrate physical activity into daily life. 1. Habit stacking. This technique links a new habit to an existing habit that you already perform automatically every day. The formula is simple. After existing habit, I will new habit. For example, after hanging up a call, I will stand up and do 3 stretching movements, or right after sitting down at my desk in the morning, I will do 1 minute of box breathing. This technique eliminates the need to remember to perform the new habit because it is triggered by an already established action. 2. Temptation bundling. This technique combines an action you want to do with an action you need to do. The formula is, I only do what I like when I do what I need to do. For example, I only allow myself to listen to my favorite podcast episode while walking for 15 minutes during lunch break. Or, I only watch the next episode of my favorite Netflix show while cycling on a stationary bike. This technique uses the appeal of an immediate reward to motivate you to perform behaviors that have long-term benefits but are less appealing. 3. Identity-based habits. This is the most powerful and sustainable strategy because it affects the deepest layer of behavior, beliefs about oneself. Instead of focusing on the outcome-based, I want to lose 5 kgs, focus on building a new identity. Identity-based, I am an active person who values health. With this approach, every small action is not a burden, but a vote to reinforce your new identity. Every time you choose to take the stairs instead of the elevator, you are casting a vote for the active person. Every time you spend 5 minutes stretching, you are casting a vote for the self-care person. The most sustainable change does not come from external tips or tricks, but from a transformation in one's own awareness. By starting with simple tactics like habit stacking and temptation bundling, you can accumulate small wins. These wins gradually build evidence, reinforce belief, and ultimately shape a new, healthier identity. This is the path of transformation from doing an action to becoming a person. Safety and customizing the route. To ensure that exercises provide maximum benefits and avoid unnecessary risks, it is extremely important to adhere to safety principles and know how to customize the route to suit oneself. General safety principles. Listen to your body. This is the golden rule. It is important to distinguish clearly between the muscle stretch sensation during exercise and the sharp pain of injury. If you feel unusual pain, stop immediately. Start slow, increase gradually. Especially for beginners, start with a low number of repetitions, reps, and short hold times. Gradually increase intensity and duration as your body gets used to it and feels more comfortable to avoid overload injuries. Correct posture is the top priority. The effectiveness of the exercise depends greatly on performing the correct posture. Always keep your back straight, avoid tensing your shoulders or neck, and perform movements in a controlled manner without jerking. Appropriate clothing. Wearing loose, comfortable clothes will help you move more easily. If you plan to do higher intensity exercises during breaks, preparing a specialized workout outfit is ideal. Contraindications and warnings. Although localized exercises are generally safe, some cases require caution or consultation with a medical professional. For physical exercises, individuals with a history of spinal conditions such as herniated discs or severe degeneration should be especially careful with strong spinal twisting movements. Perform these movements gently and within a pain-free range. For breathing exercises, breathing techniques are generally safe. However, methods involving strong changes in breathing rhythm or prolonged breath holding, such as 4 to 7-8 breathing, box breathing, may not be suitable for some individuals. Cases that require medical consultation before practicing include severe cardiovascular disease, uncontrolled high blood pressure, epilepsy, glaucoma, history of stroke or aneurysm, severe mental disorders such as schizophrenia, bipolar disorder, and pregnant women. End of Part 3. Please click like and subscribe to support. Part 4 will follow. Thank you. See you later.